Hi everyone, thank you for joining us, and we will be talking about the common breastfeeding problems and also the solutions to those problems and weaning. And about Kathy, she is the founder of Healthy Babies, Happy Moms, and which is actually based in Rhode Island. And she has enjoyed a 30-year career that has included work in neonatal ICU, home health care, and the corporate setting. She's also worked as a member of the Physicians Committee for Breastfeeding in Rhode Island and Rhode Island Breastfeeding Coalition. And she continues to serve as the workplace initiative leader and the contributor to the Academy of Breastfeeding Medicine statement. And of course, she is very, very experienced and has a lot of knowledge about breastfeeding. And so we'll just get started with our questions and our session. So, Kathy, do you want to add anything else?
No, nothing else.
Okay.
Thank you.
So, yeah, so I guess I had actually put up a question box on my stories, and a lot of moms responded with few of the common, breastfeeding problems, which everybody faces, like all the new moms, face the problems. And first, the first thing which, occurs is the improper latching.
Right.
So, when a new mom comes to you, so what do you kind of recommend, the series of steps in order to tackle any kind of like common problems that they might have?
Okay, so I think the first thing I would say is that I want moms to position themselves comfortably, sitting up straight with their shoulders forward, okay, and bringing the baby to them. Not leaning into the baby, not folding their nipple into the baby's mouth, but physically picking the baby up and putting the baby on the breast, okay?
Mm-hmm.
And then I think it also helps moms if they try to remember to kind of lead with the chin, okay? And to line up the baby's nose to their nipple. A lot of times women will kind of nosedive the baby, and the nose touches first and the chin is off. And when that happens, you're pinching the nipple, and it's very, very painful, okay?
Mm-hmm.
So leading with the chin, getting the chin in, but the nose off, and both cheeks really deep and touching the breast is the best way to get a pain-free latch.
Mm-hmm. And is there something about the position? Like, do you recommend certain kind of positions for certain, C-section moms probably, and so on?
Yeah, so C-section moms usually like the football hold because there's nothing on their tummy. So I would say to get started, usually the best positions are the football hold or the cross cradle, okay?
Mm-hmm.
One thing that I will say, and I'm seeing a lot of this lately, is that after about 3 or 4 weeks, or when a baby reaches about 9 or 10 pounds and starts having better head control, they don't like those positions anymore, okay?
Mm-hmm.
And often we get calls from moms saying, I don't know what's going on. He's fighting me all the time. I can't figure out what the problem is. And usually when you change to the cradle hold at that age and weight, nursing is a breeze, okay?
Mm-hmm.
And it's so much easier. You don't need pillows anymore. You can have a free hand. So I really want to encourage moms, when their baby's fighting them on something, it's usually because they're ready for something different, and it's usually a good time to change the position.
Okay. There might be a question. Let me see. Okay. So I guess also there are a few myths around the sideline position. So do you have any comments on that?
So did you say myths around it?
Yeah, I mean, some people say that, it's not good to feed when, in a sideline position. So, what
So
do you?
I'm a fan of it, personally. I just yesterday showed a mom how to do it, and her baby's 2 weeks old. But 2 weeks ago, she wasn't able to do it because she was in such discomfort, like laying down was too difficult. But it really, if you can manage it, it will really allow you to get rest, even if you don't sleep when
Mm-hmm.
you are laying down. Just to get off your bottom
Mm-hmm.
and to lay down, you will feel very, very relaxed, okay?
Mm-hmm.
And lying down also works great on the couch. So if your baby's like having a feeding marathon, you can lay on the couch and put your bottom and your back all the way up against the couch and lay there and watch TV.
Mm-hmm.
When you're nursing lying down, a couple things that are important are to have your hips stacked so that they're one right below the other. Often moms will have the hip that is on the bed or the couch out in front of them. so their body is tilted.
Mm-hmm.
And that prevents the baby from getting close enough to mom to get a good latch. So you want one hip right below the other.
Mm-hmm.
And then the other thing is, often in the sideline position, moms will put the baby so their mouth is right at the nipple, like a bullseye. And that really hurts when you're lying down. You actually want your baby to be a little bit below the breast, kind of looking up at it, having that nose to nipple lined up, okay? And sometimes you need to lean into the baby a little bit to help them latch. And it takes practice. And I recommend doing it like at the nap, during nap time during the day, so that you're practicing during the day and not doing it at 3 o'clock in the morning when you're tired. Okay.
Yeah.
But it really is a really comfortable way to nurse, and especially when your baby is young, it help you recover.
So a mom has actually asked a question. My baby is a month old. While breastfeeding, she moves her head here and there while latching. Why is that so?
So that is exactly what I was talking about. Your baby, I'm guessing, is probably ready to nurse in the cradle hold now, okay? And doesn't like the position that you're using. And so in the cradle hold, you want your baby's head in your elbow. You want your bicep touching your breast. And you want your baby's bum in your hand. And their bum should be all the way over on the opposite hip, okay? So that you're really lined up nose to nipple. And then your opposite hand can support the breast and help the baby to latch on. Usually that stops all that head bobbing and fighting at the breast.
Okay.
Okay.
So in terms of like another, so in terms of like another, you can read the comments
I know.
below.
Love her.
So another common problem, which all the new moms, most of them have complaints about, is the low milk supply.
Right.
And how, I mean, at some point, all the moms actually doubt their milk supply. And they try to resort to, different ways in which they can increase the milk supply. So what do you have to say about that?
Okay. So you are right. At a certain point in time, everybody doubts their milk supply. And so what I say about that is the way to judge your milk supply is by how your baby is doing. Okay. And if your baby is pooping and peeing enough, is mostly happy, is having periods of sound sleep, okay, is gaining weight, and this week is better than last week, you're doing great, okay? Often it's a perceived low supply, and they're really a low supply, okay? Another thing that happens is that moms will doubt their milk supply based on what they get out of the pump. Okay? I never want any of you to judge your milk supply based on what you get out of a pump. There are so many variables with that. For example, are you using a crappy hand pump, or are you using a hospital grade pump? Did your baby eat a half an hour ago, or has it been 3 hours since your baby last ate? Are you dehydrated? Are you stressed? There's so many variables. So please never judge your milk supply based on what you get out of the pump, just by how your baby is behaving. And also, you should feel a little bit full before a feeding and definitely lighter afterwards. And your baby should come off the breast a happy camper, okay? And if all those things are happening, your milk supply is fine.
Okay. So usually sometimes it happens, when you've just delivered, either in the case of C-section or, different kinds of deliveries and everything. Some moms often feel that they are not producing enough milk compared to other moms who say, oh, I was producing a lot of milk right away.
Right.
So, I mean, what do you have to say for those moms?
Okay. So it's very rare that anybody is producing a lot of milk in the first couple of days. Okay. What you're producing is colostrum, and you have to think of colostrum like a milkshake. Okay. A teaspoon of a milkshake has a lot of calories and protein and fat, but it doesn't have the volume, okay, that a glass of milk has. Okay. So the same is true of, formula. A baby next door in the room next door could be getting 2 ounces of formula at a feeding, but your baby that's nursing is only getting a teaspoon of colostrum. Calories, protein, and fat, it's actually better. What's missing is all the water, okay? So it is normal for you to feel like you don't have anything in the beginning, and for your baby to be nursing for a long time, like 20 minutes side, okay? And that's because your baby's trying to get your milk to come in. Once your milk comes in, you'll see that those feedings get shorter, okay? And the best way to get your milk to come in is to nurse frequently, okay? And if for some reason your baby can't nurse, to pump frequently, all right? But try to trust your body that it will do what it's supposed to. And definitely, I beg of you not to compare yourself with other women. Okay? Because I'll have moms come in crying and saying, I only get 1 ounce. You told me to pump every morning after the first morning feeding, and I only get 1 ounce. And my friend gets, 6 ounces when she same time every morning. And then I'll find out, her friend's baby is 20 pounds, her baby is 7, and her friend's baby is 4 months old, okay? So it's not going to do you any good to compare with anybody else. And if you're really concerned about your milk supply, try to see a lactation consultant so that we can help, okay? And there's a question right now. Can I read it?
If you're worried about milk supply, should you see a lactation consultant? When is the best time to seek help?
So if you're worried about your milk supply, you should see a lactation consultant, because I think we can do a lot to reassure you, if everything is fine, that there's nothing to worry about. If there is something wrong, we can help you turn it around. As far as when is the best time to seek help, always the sooner the better, okay? When you're nursing, you have a certain window of opportunity to get your milk supply established, okay? And it's usually within the first month. Moms that have had a C-section or a significant blood loss, that time is extended a little bit. But for the average woman that has a vaginal birth, you're probably going to get it going on within the first 2 weeks, okay? And so you want to take advantage of that window of opportunity of hormonal happiness to get things started. So if you really are concerned about your supply, reach out to somebody sooner rather than later, please.
Okay. So another common problem which people face is engorgement. And so what should women do about that?
So there's 2 kinds of engorgement. One is pathological, and that happens when your milk comes in, okay? And it can be varying degrees of discomfort for women. But if your milk comes in and you're experiencing pathological engorgement, what you need to know is that 2 things are actually going on. One is that milk is being produced and your body is producing way more milk than your baby needs, okay? The other is that you have swelling, okay? Your breast is swollen in addition, okay? So they're going to be very big, they could be hot, they could be red, and they could be hard, okay? So when that happens, the best thing to do is to either nurse or pump, okay? And even nursing it will bring you some relief, but it might not bring you enough relief, but try that first, okay? In some instances, your breast will be so big and uncomfortable, it will be difficult for the baby to latch. And so then you need to pump first, okay? And so the trick with pumping when you have pathological engorgement is to pump one side at a time, okay? So you'll put the pump on one breast, you'll make sure to seal off the other tubing and read the instructions for the pump so that you're not losing suction. Pump one side at a time for 5 minutes, okay? Set your iPhone timer for 5 minutes, do the left breast for 5 minutes, then do the right. And while you're doing it, you're gonna do a lot of massage, okay? Kind of pressing and holding all those hard areas. What will happen probably is when you do the first 5 minutes on the left side, you don't get anything, okay? And I don't want you to panic. Then go to the right side and do 5 minutes. Then go back to the left side, and that's when the milk will start flowing, okay? And what you'll see is if you have that pathological engorgement when your milk comes in, you might go back and forth, side to side for an hour, okay, before you get relief. But if you pump both breasts at the same time and do it for 20 minutes, you're not going to get anything. It's
Okay.
why it is, but that's just the way it is. So that is the best way to get rid of the pathological engorgement. And you'll probably only have to pump that long one time.
Mm-hmm.
And then, and then the rest of for the next 24 hours or so, you're just going to pump enough to make yourself comfortable, always nursing first. And you should see that over 24 to 48 hours, your breast to feel normal. And what's happening is the swelling goes down, okay? But the milk supply doesn't. So a lot of worry a couple of days later, like, oh, now I don't have any milk because I feel good. You're supposed to feel good, okay?
Yeah.
Not supposed to be walking around like Dolly Parton for 9 months. Supposed to, that swelling is going to go away, but the milk supply won't, okay? So that's pathological engorgement. And then you might, let's say your baby one night sleeps through the night for 8 hours, okay? You are so happy, but you wake up and you're dying because you're super full, okay? So you can do the same thing. But at that point, you're further down the road. Maybe you're 6 to 8 weeks in. And at that point, you can pump both breasts at the same time if you want to, just enough to make yourself comfortable. Because you want to teach your body that it doesn't need to produce tons of milk during the night, okay? I don't want anybody pumping during the night. I want you sleeping, okay?
So in case if you don't have access to a pump, in those cases, what do you recommend to reduce that swelling?
Okay, so to reduce the swelling.
And also, if you don't have a pump, then how should you go about it with the nursing?
The best option is nursing your baby frequently and hand expressing, okay? Great video on this, I believe it's the Stanford website. If you just Google manual expression of breast milk, there's a great video that will show you how to do it.
Okay.
Okay, and most moms will get relief with that. It's just a little more time-consuming. But honestly, there's plenty of women that manually express without it all and do a great job.
So a mom has asked a question, is there any galactagogue food?
Yes. So fenugreek is an herb that is considered the most, it's probably the most popular galactagogue that people will take to help increase their milk supply. It's in several teas. It's in different supplements that are made by companies like Mother Love and Pumping Princess are two that come to mind. The important thing to know about fenugreek is if you are a woman that has hypothyroidism and is taking Synthroid, you cannot take anything with fenugreek in it because it inactivates Synthroid. Okay, so that's really important to know, and it's in like every galactagogue thing that's sold. Okay. Other things that work really well are oatmeal with ground flax. If you Google lactation cookies, there are great recipes for cookies that have oatmeal, ground flax, and brewer's yeast, and a lot of women swear by that. Dark beer, if you like beer, a Guinness at night helps. There's a lot of anecdotal experience that a combination of water and half Gatorade or like Body Armor, one of the electrolyte drinks, really helps also to increase your supply, especially in moms that are dehydrated. Okay, just the water doesn't quite do it. You need the electrolytes and the sugar. Okay. Our recipes also online for lactation smoothies that have a lot of increase their milk supply.
So a mom has asked a question, should we go for hot, wet compressions before pumping and cold compressions after pumping in case of engorgement?
So that definitely does help. Okay. But the only thing I will say is I want you to get the best results with the minimum amount of work. And a lot of women go through this big production every time they pump. They put warm compresses on afterwards, and then they pump, and then they put cold afterwards, and they do that every time. Okay. It's a temporary thing. Okay. The warm does tend to help get the milk flowing, and the cold tends to decrease the swelling after pumping. Okay. That we talked about with pathological engorgement. So thank you for reminding me about that, because those are good points. But again, they're just something that you only need to do temporarily. It's not something you need to do every time you pump or when you get engorged further down the road. Okay?
Okay. So another thing which people complain about is clogged ducts or, mastitis. So in that case, what are the solutions for that?
Okay, so there's two kinds of mastitis. One is, I guess what you'd call mechanical, and the other's infection. Okay, and most mastitis always starts out as mechanical. Okay, and that's where you get a plug, you don't get it out, and things get backed up, and then you start having these symptomatic feelings of, maybe you have a fever, maybe you feel achy all over, maybe you feel like flu. Sometimes women will be nauseous and throw up. Okay.
Yeah.
In that situation, the most important thing is to get that plug out. Okay. And the best way to do it is to nurse. Okay. And I would take your thumb and just kind of put some gentle pressure on that lump and massage it and see if you can get it to come out. Okay.
Okay.
If that doesn't work, then you can put a warm compress on it and then try to pump doing the same thing. Sometimes you won't get it out the first time you do that, but you'll get it out the second time. Okay. So if it's truly just a mechanical mastitis, getting that plug out will fix everything and you'll feel all better. Okay. And then you need to kind of monitor that area frequently because people tend to get plugs over and over again in the same. Okay. However, if you get the plug out and you still don't feel it and you see a red spot that's hot, then you probably have an infection. And in that instance, you need to contact your doctor and you need to get a prescription for antibiotics. And breast tissue is very hard to penetrate with antibiotics. So you need to make sure that you take the full 10, 14-day course to get rid of it. Okay?
Okay. So a mom has asked a question, my baby sometimes vomit milk after feeding. What to do about that?
Okay. So if your baby spits up after feeding, it is nothing to worry about, provided your baby is like perfectly happy afterwards. They're gaining weight. Okay. They may or may want to eat more after they throw up. But provided your baby is not unhappy, it's really just a plumbing and a laundry problem. Okay. Babies have a very immature sphincter in their esophagus. So a lot of times when they burp, milk will come up. We call that a wet burp. And they're perfectly fine. Okay. And sometimes we call those babies like happy spitters. Like they just spit up all the time. It's more a laundry problem for mom than it's anything wrong with the baby. So if your baby pooping and peeing and gaining weight, and sleeping soundly and mostly happy and they're throwing up, it's nothing to worry about. Okay. Now, if the baby's unhappy, okay, if you can really tell, like after feeding your baby is like in distress, and uncomfortable, then you should probably talk to your doctor, your baby's pediatrician, about whether or not your baby might have reflux.
Yeah.
But I will say, if your baby is breastfeeding and you're about reflux, I would ask you to see a lactation consultant first. Okay. Because often it's a supply issue and the way you're nursing. And if we fix that, then your baby will be happy. They won't be throwing up and there's no need to have reflux meds. Okay.
Okay. So another thing which people complain about is, of course, like sore nipples and pain and cracked nipples. And I think this I've heard from a lot of moms. So there are a lot of strategies of actually dealing with that. But what would you say to those moms?
So the first thing I would say is that breastfeeding is not supposed to hurt. Okay. Excruciating pain is not part of the plan. And what I wish every mom knew is that if you are in pain when you're nursing, your baby actually isn't getting milk. Okay. The baby's pinching the nipple and hurting you. And it's just a waste of time for you because it's not an effective feeding. Okay. So the first thing is you got to fix the latch and you got to get help with that. Okay. You will, when you nurse for the first time, experience some discomfort. I don't want to say discomfort. It's almost like your nipples feel chapped, like your lip. Okay. Just because of the activity. You've never had activity quite like that before. Okay. And lanolin or some kind of nipple butter works really well to make you comfortable. And I'm a huge fan of hydrogels. Love them. Okay. I tell every mom to get them. I carry them in my car and I pass them out like candy. They are glycerin gel pads. Several different companies make them, but I prefer the Medela ones because you get 4 to a box and they're cheaper. And they're thin and they don't you can't really tell that you're wearing them. But if you put those in the refrigerator while you're nursing or pumping, and then put a little bit of lanolin on and those hydrogels afterwards, it will heal you up right away if you actually have wounds because your baby's been nursing incorrectly. But if you just are chapped, it will get rid of that chapped feeling. They're really great. So it's not to hurt, and please get help if it is hurting. Okay.
So a mom actually asked me a question about nipple shields. She wanted to use nipple shield, and she just wanted to know if she can use it right away, or if she needs to contact a doctor or lactation consultant regarding the use.
Okay, this is a great question. So here's the thing about nipple shields. It used to be that you could only get a nipple shield from a lactation consultant or a doctor. And in fact, we have them in my office. I will not sell them to anybody that's not a patient of mine. But now you can go into Target and they're in with all the breastfeeding stuff. And so everybody thinks it's just another thing that they're supposed to use. Okay.
Yeah.
And they really need to be used under medical supervision. Because what happens often is if a mom doesn't know how to use them correctly, the baby uses it as a pacifier. The baby's not draining the breast. And because the baby's not draining the breast, mom's supply decreases and are not happy and nursing all the time. And the mom thinks it's great that their baby's nursing all the time, but really it's time because it's pacifying. So if you feel you need to use a nipple shield, please see a lactation consultant. Okay. Babies who are using a shield need to have their weight monitored by either us or the pediatrician. And you need to be shown how to use it correctly because, I would say that more often than not, women do not use it correctly.
Okay.
And it can have consequences down the road, especially if you're trying to get your milk supply established. Moms who use a nipple shield are supposed to pump after every nursing session.
Okay.
And, it doesn't say that on the nipple shield. Okay. And that is protect and get your supply established. So I just beg you, if you are using one, to make an appointment with a lactation consultant so that can show you how to do it. Okay.
So, do all the moms need to use it, or there are certain cases in which they should be using that?
No, moms do not need to use it. Okay. There are very specific medical reasons to use it. Moms that have inverted nipples. Sometimes I'll have a mom who is so badly damaged, but she really wants to nurse, and the only way to nurse comfortably is to use a nipple shield, so I'll use it for that. Okay. They're great for preemies and babies that were born early because it helps them to latch, or babies that have gotten a lot of bottles and then we need to transition to the breast. I'll use it.
Okay.
But really, I would say 5% of the women that are nursing need to use a nipple shield. So just because they're out there and you can buy them does not mean you need to use it.
Okay.
Okay.
So, so another mom actually asked me a question about bottle because you mentioned it. So she wants to use, I think she's just probably 3 or 4 weeks. She delivered a baby, and she wanted to use a bottle at night. And then, she was asking how many times can she use a bottle along with breastfeeding. She says her child is feeding properly and latching properly, but she does want to incorporate bottle as well.
So I want her to incorporate bottles too. I think even if you're staying home, especially during COVID, I really want to encourage moms to have a good supply of milk in the freezer so you can come and go as you need to. And if you're working, especially, you're going to need it. If you have other children, you're going to want to be able to attend to those kids, especially if you have a toddler. Invariably, that kid's going to have a meltdown and the baby's going to be screaming to be fed. Okay. And you have your husband give the baby a bottle so you can deal with the toddler. So the best thing to do if you want to introduce a bottle is to use a wide-based bottle, okay, not a narrow one. Some examples of that are the Avent, the Komotomo, the Born Free, the Spectra bottle is wide. So you want to use a wide-based bottle. I think she said her baby was 3 or 4 weeks. Is that right?
I think she's almost like 4 weeks, a month she delivered. Yeah.
About 3 ounces. Okay. And so hopefully you've collected some breast milk and you can have a 3-ounce bottle. And I want you to plan to leave the house when your baby is due to eat. So I'm just making up stuff. But let's say you think your baby's going to eat at 5 o'clock. I want you to pump at 4:45. You'll have the bottle that you already made and then the milk that you pumped. And then I want you to leave for a good 3 hours and let your husband, your mother, your wife, your girlfriend, whoever, feed the baby. Okay? If you feed the baby and then leave, the baby probably isn't going to eat while you're gone. Okay? And we want you to be out of the house doing something for you and somebody else dealing with the baby. And I'm 100% confident it will go just fine and the baby will take it. Okay? And then once you introduce the bottle, you want to make sure that the baby has a bottle probably 2 to 3 times a week, just to make sure that the baby will always take it. Okay? I think that's it.
So there is always like, a doubt that if you introduce bottle, then it might actually interfere or the baby might actually forget how to breastfeed.
Right. So that is possible, but that situation usually occurs when the baby is getting more bottles than breast milk. Okay. And if you have breastfeeding off to a good start, you're going back to work. I mean, there are plenty of women that nurse in the morning and at night, and the baby gets bottles all day, and the baby loves to nurse in the morning at night. So when you have problems, it's usually because you have a preemie that had to be fed with a bottle in the NICU for months, and now they're coming home and we're trying to get them to nurse. And that's where that nipple shield comes in really handy. Okay. For most kids, it's not a problem. And in fact, there are times when I will have moms have somebody feed the baby with a bottle, in the first week, because I feel the mom needs a rest. Okay. And sometimes you just kind of weigh the benefits of, I'm worried that if the mom doesn't get a little bit of sleep, she's going to give up nursing altogether. Okay. So use judiciously. I don't think bottles are a problem.
Okay. And we already talked about the flat and inverted nipples. So does the breast size or the nipple size affect in any way, the amount of milk you're producing and the breastfeeding? That's also one more myth that people usually talk about.
Right. So oddly enough, there are women with teeny tiny breasts that are nursing huge babies. And there are women with huge breasts that have supply problems. Okay. There's just no way of knowing, but the vast majority of women have all the equipment they need to produce enough milk for their baby. Okay. Very, very rare circumstances where people have breasts that appear to be perfectly normal, but they don't have milk producing tissue. And that's a medical condition that is very, very rare. Okay. So the size does not determine whether or not you're going to be able to make enough milk for your baby. Okay. Always that you're going to be able to do it.
Okay. And in case of, the nursing strike, when the baby actually refuses to breastfeed.
Right. Okay. So that is a very, very difficult situation for a mom to be in. And what I would tell you is that you need to act like you don't care if this baby ever nurses again. Okay? Because the more you force it, the less likely it's going to happen. Okay? So just honor it. Okay? If your baby does not want to nurse, stop what you're doing and move on to something else. Okay? And eventually your baby's going to be like, oh yeah, but I was hungry, and probably nurse again. Okay? And if your baby is just flat out refusing, then go ahead and pump. Okay? You can offer a bottle as a last resort, but I would have somebody else do it if you can. Okay? And it's very, very stressful for moms. I know it is, but I would just encourage you to really try to act like you don't care, like it's not bothering you at all, and not force it, because the more you force it, the worse it's going to be. Okay.
Okay.
And most kids, you know, it's like a 12-hour thing, and then all of a sudden they're over it and nobody knows what caused it. Okay.
And also one more thing is about formula feeding, because
Yeah.
you know, sometimes it happens that the moms have to resort
Yeah.
to formula feeding, and the doctors are also, you know, kind of prescribe it, and they do sometimes combination feeding, and they're always afraid that if they give formula, they might not be able to, you know, breastfeed again, and it might actually create problems.
So sometimes formula is medically necessary, and the most important thing is that the baby gets fed. Okay. If supplementation is necessary because the baby's not feeding and you're able to pump breast milk, you should ask your doctor, can I just give the baby breast milk? And sometimes there's like a 24-hour period where you don't have breast milk and they have to give formula. And then once you start getting breast milk, you just switch over to breast milk. Okay. But it's necessary sometimes. And there are women that do a combination. There are women that go back to work and aren't able to keep up with the pumping. And so they have to give 1 bottle of formula a day. I mean, the most important thing is that your baby's getting some breast milk for a long amount of time. Okay. So even if you're only nursing twice a day, that is better than not nursing at all. Okay. So, you know, have a little bit of compassion for yourself if you have to use formula, and feel good about what you are doing instead of what you're not able to do.
Okay. And then another thing is about the pacifier use. A lot of moms ask question about, like, when should they use a pacifier? If they use a pacifier, they might, you know, interfere with the breastfeeding and so on.
Okay. So, I am a NICU nurse by training, so I think that babies have a need to suck sometimes and not get nutrition, okay? And sometimes do that when they're nursing, and if you have time for that, I would highly recommend it, okay? Just let them nurse as much as they want to. But sometimes you need to go to the bathroom and not listen to your baby scream, okay? And so giving your baby a pacifier at those times is perfectly appropriate, as is giving your baby a pacifier after you've had a good feeding and they're kind of sleepy and you pop it in their mouth and they suck on it and they fall asleep. Okay. I think those are totally appropriate uses of a pacifier, and sometimes necessary in like the first 3 months. What isn't appropriate is if your baby has their fists clenched and their eyes wide open and they're going gangbusters on that pacifier. And they're doing that because you're saying, I just fed you, I'm not going to feed you again. Okay. You shouldn't need to eat. That baby does need to eat. Okay. And I want you to remember that every feeding you give your baby during the day is one they do not need at 2 o'clock in the morning. So if your baby is hungry, feed them. If they just need to soothe themselves, they'll usually do it for 5 minutes and conk out and spit the pacifier out. And that's also, most kids will give up a pacifier, or you can kind of take it away and wean them from it around 3 months. And they start to find their hands, which I prefer because you don't have to go up and get their hands from 3 o'clock in the morning. But if you want to, you can wean them from a pacifier usually around 3 months. Okay.
Okay. And sorry.
It's totally fine. As long as you're not using a pacifier in place of feeding your baby, it's totally fine. And then the other thing to say is, I'm sure you've seen, there's some research that using a pacifier, they're saying, assist with SIDS, okay, with babies sucking like that. So, you know, with anything, you can find things for it and things against it on the internet, okay? And when that happens, you need to make an educated decision about what's best for your family and your baby and just go with it.
Okay. So yeah, I guess we just have few more minutes. I'm just going to talk about the weaning part.
Okay.
So, you know, the weaning part is, I guess, when is the appropriate time to wean the baby?
Okay. So,
and how should you go about that?
The American Academy of Pediatrics recommends that you nurse for a year if possible. Okay. Which many of my new moms 2 weeks in are like, are you kidding me? I can't do this for a year. But what I want to encourage you to and remind you is that you really start weaning your baby at 6 months when you introduce solid food. Most people don't think of it that way, but you are weaning, okay? And so prior to 6 months, your baby's probably nursing 6 or 7 times a day. And then at 6 months, you'll introduce solid food, which is what the American Academy of Pediatrics recommends. And sometime between 6 and 9 months, you will get to the point where your baby is having 3 meals a day and 3 or 4 nursing sessions a day. So that gets a lot easier, okay? And the period between 6 to 9 months is a little bit awkward because you're kind of gradually increasing the solid food based on what your baby is interested in, and what you'll find is that the nursing has kind of gradually decreased. Okay, so usually by 9 months you're only nursing 3 or 4 times a day, and the baby's having 3 meals a day. Often women will start to get their period around 9 months because they've spent these last 3 months kind of very gradually weaning. All right. And so from 9 months, you've got 3 meals a day, 3 or 4 nursings a day. And then if you want to, after a year, you can wean. All right. Those 3 or 4 nursings. And I would recommend that if you do not want to be nursing until about 3, that you have your baby weaned by about 14 or 15 months. Okay. Because if you don't wean them by 14 or 15 months, usually they're not going to until they're about 3. And which is, I think, great. But if that's not what you want, you might want to start to wean before then. So how do you wean a 1-year-old? Okay. The best way to do it is that you don't offer the breast, but you also don't refuse. Okay. So you take that approach, and I would also encourage you by 9 months to be nursing in the same place all the time, usually in the baby's room, in a rocker, because when you make that transition to 3 or 4 nursings a day, it's usually before the morning nap, before the afternoon nap, and before your baby goes to bed at night. And some working women will also nurse in the morning before they go to work. So if you want to wean, you would pick the feeding that is the most inconvenient for you and have somebody else put your baby to bed. Okay. And you'll see that usually it goes very easily, as long as you aren't fighting with them. Okay. And a toddler is very easily distracted. And often if they want to nurse and you say, oh, well, then we're going to go into your room, into the rocker, they don't really want to be bothered. Their room, because they've got other stuff going on. So if you kind of take that approach, it usually goes pretty easily. Okay. If you're weaning prior to a year, okay, so let's say your baby is 6 months old, you're going back to work, you have the kind of job that you can't pump and you just want to wean, there's 2 ways to do it. One of them is to drop a feeding, whatever feeding is most inconvenient for you, okay, in a particular day, and go about 3 or 4 days without nursing at that time, and your baby just gets a bottle, okay? That'll help your body naturally decrease your milk supply at that time of day. And then once you're comfortable at that time of day, you're going to pick another feeding to drop probably later in the day. Like maybe if you drop the 10 o'clock feeding, I'd drop the 4 o'clock feeding. And of course, they're approximate. So that's one way to do it. And every 3 or 4 days, you just drop a feeding and replace it with a bottle. Okay? Another way to do it, if you really want to just be done with it and wean, is to gradually extend the amount of time you go without pumping. So, well, let's say you are pumping every 3 hours. Okay? You would start pumping every 4 hours. All right? And then every 5 hours. You would just gradually extend it as long as you can and still be comfortable, so that you're decreasing your supply that way. Okay.
Okay. So sometimes actually moms, they opt for extended breastfeeding. They want to breastfeed for a long time, but they want to drop the night nursing. So in that case, and when the kid is actually a toddler and they, insist on nursing at that time, And what is the best way of actually, night weaning, let's say, just the night wean?
Oh, that is a whole different subject. Okay.
Okay.
Um, so, so I consider that actually more of a sleep issue. Okay.
Okay.
But one thing I will say is usually when babies are waking up at night to nurse, okay, it's because they are not getting enough calories during the day.
Mm-hmm.
So I would encourage moms to make sure that their baby is getting enough to eat during the day.
Yeah.
And I often see this with people that are doing kind of the eat, play, sleep thing, because you're only feeding your baby every 3 or 4 hours during the day, but they still need 8 feedings in 24 hours. And if they're not getting them during the day, they're going to get them at night.
Mm-hmm.
So if you have a baby that's nursing at night and you don't want to nurse at night, I would really encourage you to make sure that you're not restricting the feedings during the day. Okay.
Mm-hmm.
And the second thing I would say is if you're hopefully your baby is in their own crib in their own room when you're trying to wean the nighttime nursing, because if the baby is not, it's not going to happen. Okay. So I would move the baby to their own crib in their own room, and I would tell you to keep going to them and feeding them when they wake up. I would make sure that they're truly demanding to be fed, crying with no chance of going back to sleep on their own, and not just stirring or talking to themselves or something like that, because they don't need to be fed at night. Babies by 4 months should be sleeping about 12 hours at night and getting all their feedings during the day. Okay. So if it's truly a sleep issue, I would say we have a great sleep class that's offered monthly that might be helpful to get a mom that's having problems nursing at night turn things around today. Okay.
Okay. Yeah, so I'll probably just end this session just by one question, because a lot of moms actually resort to combination feeding, and then they're often, confused about, how to maintain their milk supply and everything. So in that case, what would you recommend to moms, if they have to maintain their milk supply when they're actually doing a combination feeding?
Okay. So the most important thing is frequency and consistency. Okay. So if you are pumping every day at the same time, or nursing every day at the same time, your body will make milk for your baby. Okay. And I'll use physicians as an example. There are plenty of doctors that cannot pump during the day. Okay. So they just nurse their baby in the morning and at night. And I get them weaned down to that by 3 months, because they have to go back to work, and they're able to do that for a year. Okay. If you keep doing it, your body will make the milk. Okay. And then the only other thing I would say is make sure that you're well hydrated. Okay. And healthy. I think women underestimate how hydrated they are or aren't, and the impact that it has on their milk supply. So you should be able to maintain it if you are doing those things.
Okay. So, yeah, Kathy, I think we'll end this session. It was really, really great. There was so much information, and we got to learn a lot from you. And it is my pleasure to have you here. And thank you so much for taking out the time for this.
Well, this brings me to the end of this video. Thank you for watching. If you liked the video, subscribe to my YouTube channel, Quickmommyhacks, and follow me on Instagram